Pam, and thank you so much for taking the time to visit with us today.
Hello, thank you.
You know, there is a lot of concern surrounding the COVID-19 pandemic, and some of that concern has caused those who were once interested in making a move to Carillon to put those plans on hold. As such, I just wanted to take a moment to visit with Carillon leadership to discuss how our community is responding. Now, Pam, you've been with Carillon for 13 years now and have served as Executive Director for a little over a year, is that correct?
That's right.
That's awesome. So first and foremost, I just want to thank you. I want to thank you for your service to our community, and I want to commend you and your team for doing a wonderful job.
Thank you.
As the Executive Director, you're in charge of the entire community of Carillon. That's no easy task, right? So talk to me a little bit about how Carillon has responded to COVID-19.
So Carillon has been very aggressive with our approach, if you're thinking, I don't want to come to Carillon because of COVID, you've got the wrong thought process, because Carillon's on top of it. We started back in March as soon as things hit in New York City. I remember it was on a weekend, and I called the leadership team on a Sunday and said, we've got to get together today, anybody that can come and meet with me, so that we can have a plan in place for Monday morning. And we started immediately. That team showed up. We met most of the day, and on Monday morning we started our screening processes, and we started putting things in place to keep COVID out.
That is fantastic. That is so great. And I really appreciate the dedication of leadership, really, to be present and available and ready to adjust and pivot so quickly. So some may not know that Carillon is predominantly an independent living community. They do provide, however, access to both assisted and skilled nursing if ever needed. Being that Carillon offers that full continuum of care, how has Carillon prioritized resident health?
Well, definitely resident health is top priority. We have over 400 residents that live on our campus. And as you mentioned, most of those live in independent living. So those residents are going out and about. They go outside, they go off campus, they go out of town. But whenever they return to the campus and they want to come inside the buildings, they're going to get screened. And not only do they get screened at that time, we call every resident every day just to check on them, to see how they're doing, to make sure that they're not feeling any of those symptoms that we're all so worried about with COVID. And that should give them and their families, and it gives me that peace of mind that things are okay, we're on top of it, and if somebody needs some help, we're going to get it right away.
That is awesome. And as someone who's a part of the team, who also goes through that screening process, I appreciate the care and the concern and your adherence to the guidelines that have been put in place. And so thank you for that. So what changes, if any, can we expect going forward as it relates to how we operate as a community?
Well, definitely, if COVID hasn't taught us this, they haven't taught us anything, because we have done nothing but change from day one when we started. I even remember meeting, especially in March and April, I would meet with leadership team in the morning, and then we'd have to turn around and meet in the afternoon because things changed that quickly. Mm-hmm. And so we had to adapt our thought processes and our systems and what we were doing. And that's just going to continue because we continue to learn more information about COVID. And until we understand it totally and completely, we will not quit evolving. I do know that things are getting better, in my opinion, as I listen to our politicians and definitely the CDC, how things are moving along in the research side. So I feel like a vaccine's coming, and so we know we're going to change some more. Mm-hmm. And we know that as we adapt and make those changes, the staff have to be trained in what that's going to be, and then we do a lot of communicating. I believe the residents that live here at Carillon probably know more about COVID than anybody else.
I don't doubt it, actually. I don't doubt it. So, people might not know this, but Carillon is a cell-phone not-for-profit community. However, they are professionally managed by Life Care Services. And one of the benefits of Life Care Services, I believe, for the community is that they are super plugged into the federal, state, and local guidelines. And so it really allows the community of Carillon, especially the team, to pivot and adjust very quickly because they're managed by Life Care Services. What value above and beyond that do you feel Life Care Services brings to Carillon?
Well, definitely. So myself and the administrator are both employees of Life Care Services. And from the get-go, Life Care Services has been on top of it because we have about 140 communities like Carillon across the United States. Therefore, we have about 40,000 senior adults that are depending on us to know what we're doing. We have nurses that are infection control specialists, and so they have helped all our communities navigate this and put in some excellent processes. I don't see how anybody can do it successfully without a management company like Life Care. And I am truly thankful to be a part of that team, and I'm thankful for the resources they provided me right here in Lubbock, Texas.
As are we. So last question for those watching, why choose Carillon?
Carillon is the best place ever. That's why you choose Carillon. But I'll tell you, when I got here about 13 years ago, 2007, I remember walking down a hallway, and I was in an apartment building, and I saw two ladies coming out of an apartment, and I stopped them and said, obviously, how are you doing today? But I knew they didn't live there, and I said, are you just out visiting today? And they're like, no, actually, the lady that lives here is not feeling well, and we're all taking turns checking on her. And as they told me that, it was at that moment I knew I was at the right place, and I knew I was at my forever home, and that's what you can come and enjoy and live and be a part of.
That's awesome. Thank you so much for sharing that with myself and those watching. We certainly do appreciate Carillon being a part of the Lubbock community, and I thank you for your time.
Thank you.